And it's time for our big conversation. Now, sanitation is a constitutional right in Kenya, and the responsibility rests on the shoulders of the county government. And Article 43 of the Constitution of Kenya guarantees the right to clean water and reasonable standards of sanitation. Now, what appears in the Constitution is one thing, but the reality for millions of Kenya is that sanitation is a dream. It is estimated that over 8 million Kenyans do not have access to toilets, leading to open defecation, otherwise known as flying toilets. On the big conversation, we want to find out what is the impact of unsafe water, poor hygiene, and sanitation in Kenya. How can more resources be channeled towards providing adequate sanitation in our communities? This morning, we are delighted to be joined in studio by Dr.Kefa Ombacho, who is the Director, Public Health Department in the Ministry of Health. A very good morning to you.
Good morning.
Now, welcome to the program. Now, many people seem to think that sanitation simply means access to clean water. Is that all there is to the word sanitation?
I think thank you very much for even hosting us. I think that very simple understanding to the extent makes sense, but I think the bigger picture is that it is a combination of access to safe water, access to some disposal, proper disposal facilities in terms of waste management.
Okay.
Under waste management, we will be having both liquid and solid. But majorly, the biggest problem that we have generally is on liquid waste, and that is the access to some kind of toilet, whether waterborne or dry, that is pit. I think that's the biggest problem that we have. And indeed, the bigger picture then is that over 50% of all the disease burden that we actually struggle in this country generally, in the country that translates to the counties, is basically diseases that can be prevented by only sifting issues and actually address issues of safe water and sanitation.
Wow, that is 50% is a very huge number. Now, even where there are toilets, most are pit latrines, which provide insufficient levels of safety and hygiene. Yet, especially in the rural areas, when a facility like a hospital, church, or school is being constructed, it will have pit latrines. Why is it?
I think one of the bigger thing when we discuss about sanitation and safe water, I think the word hygiene it comprises issues of change of mindset. I think like before, all of us believed that it didn't matter where you went, maybe in the bush. I mean, that's what people had in mind, but they didn't. I think basically what that brings is that there is lack of the connection and having information about the risk factors of disease causation. And indeed, in the bigger picture of trying to have this access improved, one of the big issues is actually, and that's why we are tagging the community-led total sanitation as the entry point. That means that we provide information to the people to be able to understand. And if you go back, there have been drives and there have been initiatives in this country, like some years back we had the VIP latrine. Basically, people were getting those facilities and they didn't understand why they should have such a nice facilities. So they thought maybe that was better because it could have been a better use for a store instead of actually using it for a toilet.
Store?
Yes.
Okay, now, of course, Article 43 of the Constitution guarantees the right to clean water and reasonable standards of sanitation. What do we mean by reasonable standards, and does the pit latrine fit into that category?
Yes, and just for information, I think when there was that agitation for these rights, the Ministry of Health indeed worked around trying to have that one as a right. Basically, is the reasonableness is that it should be able to be a place where the human waste or animal waste can be disposed. I think for this purpose we are talking about human waste.
Human, yes.
can be disposed and they cannot have connection or cannot have contact to human.
Okay.
I think that's the reasonableness.
And hence the pit.
The pit.
Because it is something that you will cover if it gets...
And indeed, why using that word, we thought we should not be prescriptive. Because a toilet normally should be a very good place. Some toilets you have been able to, the high class, you have got piped music, can even read. But we also know that there are people who cannot afford.
Yes.
So a pit with a top cover and some kind of wall, whether it is
some shelter,
some leaves or some grass touched, that is reasonable because it provide privacy. It will also provide that pit which is meant for disposal. Right.
So of course, we need to hear how Kenyans can seek redress, on the violation of this right. Because how do we enforce? Like now, pit latrines. I just discovered the other day, there are certain parts of the country where you cannot build pit latrines because the soil. If the soil is sand, is it Wajir? There are certain places where you cannot. So what happens then? What are the alternatives available in such areas?
I think just to put right first in terms of statistics, right? We have over 5,000 Kenyans who are actually going to the bush.
Wait, 5?
Or around 5,000 Kenyans out of the 43 million.
5,000.
Those guys are going to the bush. That means that we are at risk, depending on where that waste will go. But let me answer the question about the soil texture. We are aware that there are places which are rocky. We are places which are sandy. There are places where the water
table is high.
The technologies are available to answer all that. Now, for example, if I address the soil where you are saying is sandy, the pits can be protected by actually using either a drum with you make a hole both sides. As you dig, you just put it in, or culverts. Those technologies are available.
Are they being used on the ground?
Yes. There are some places which are being used, but there are also places where people just now decide that this is too expensive.
Exactly.
And that is where now we part of this big campaign is actually to ensure that people understand and that there is that technology and they should be able to make it. The disconnection between not using it, it's very expensive in this country. You are aware that from 2014, around 30 counties have reported cholera, and I think that's something that is not acceptable.
So, okay, definitely we're going to get further into this discussion and understand why is Dr. Kefa Ombacho insisting on the need for us to use this latrine. So what happens if we don't? What happens to this 5,000? What is the impact of this 5,000 who decide to go and just do it out there? Any questions, comments? 22162 is how you need to speak to us. We're taking a very short break. As for the news headlines, we'll be right back after this.
Introducing the KBC Digital app. This is a fresh way of listening to the English service. So, if you have an Android device on mobile or tablet, then you can now download the KBC Digital application. And how do you get this app? It's simple. Open the Google Store on your mobile or tablet screen and search for the KBC Digital app. Once it shows up with the KBC logo, click and download. It's absolutely free. And after you've done that and installed, then you can now use the app to listen to the latest news, features, documentaries, and the best music and entertainment shows, including The Breakfast Show, Lunchtime Music, Sundowner, Late Date, all your favorite shows on the English service. Download the KBC Digital app today and enjoy a whole range of great programs.
And in studio we have with us Dr. Kefa Ombacho, who is the Director, Public Health Department in the Ministry of Health, and we're discussing the issues of sanitation. Now, just before the break, we talked about the constitutional right that Kenyans have to access clean water and reasonable standards of sanitation. And this function rests on the shoulders of the county government. Isn't that right, Daktari?
Yes, it is.
Now, are they actually from your work and research, would you say that sanitization is actually a priority in the county government?
Thank you very much for that question. I think that question is for all of us Kenyans. Is sanitation and safe water a really priority for all of us? Maybe I would say, based on statistics, it might not. If it were, then we wouldn't have been able to have reported, reporting 30 counties reporting active diarrhea cases to the extent of some confirmed cholera. Now, why so? Maybe I think we need to lobby continuously. I am aware that even globally that there is a continuous lobbying, so we cannot be different. So that's why the Ministry of Health, with the other stakeholders at the national level, have been able to organize for a second national conference on issues of sanitation, to address issues of sanitation in this country.
Okay.
Some years back, 2014, we did have the very first national conference. We have never had any since independence.
Okay, so you had the first one in 2014.
2014.
Okay.
And we have organized for this as a forum, because in the very first one, we were addressing the question you're asking.
Okay.
That there is need to prioritize issues of sanitation and safe water access to the populations in this country.
At county level.
At county level. And we were impressed that actually the counties attended in big numbers. We agreed that there was need to actually put some budget in this within the counties to be able to address the problems within the counties.
Right.
And part of this forum, second national conference, which takes place from tomorrow up to 9th at Safari Park in Nairobi,
yes,
is to actually review the progress thereafter. What progress have we been able to make as a country in the counties, and what are the challenges that will be there? I think basically that is what we want to address, and I would only wish to request that all of us who are charged with this business must actually look at it as a priority. In any case, if we are discussing about the disease burden, and I think what we need to address is the disease burden. If we are saying, and we know that it is actually provided in, that over 50% of these diseases that we are actually struggling and managing in the hospitals within the counties and in the country are actually things that are preventable and basically can be answered by issues of reversing issues of access to sanitation, there's access to some kind of toilet facility, and safe water.
The safe water bit here.
Then I think we have got no choice. We must actually have it as a priority.
So now, a recent study put Turkana County at the top of the list in open defecation rates with over 88.4% of the residents. And you were saying only 5,000 people.
I think when we talk about 5,000, we look at the bigger population, and actually, yes, that could be the study could be giving us, but doesn't necessarily mean that the whole of Turkana.
Yeah, because you're saying 84% of the residents use open.
Yes.
So that is a huge percent. Now, so I was really shocked to hear that, poverty is not the only factor that has led to this. Apparently, cultural practices also contribute.
Yes. Could
you help us understand that bit?
I think
because so far we have dwelt on poverty. But now culture. How does culture come in?
I think culture is also a big. Actually, culture is a bigger player in this, because let us even go to the colleague Kenyans who are actually nomadics. Culturally, they believe maybe they're gonna just continue moving, and they don't have some kind of disposal for fecal matter. That's a culture.
Yes.
There are places where there could be even a toilet facility, but the culture is that maybe people don't share the toilet. So some guys have.
Or men and women.
Yes.
Or different generations.
That's culture.
Okay. Yes.
There are places where people believe, ladies believe that feces from young babies actually is not cannot infect anybody. As culture, that's actually culture. And there is also the bigger culture that there has been no problem because you cannot really see the microorganisms in the how it moves from waste up to water. That's culture. So I think the big story here is also that the people must be armed with actually information. And the bigger story is that is why the entry point, the community-led total sanitation, the bigger subject there is actually educating the people. Educating people to change from what they didn't know
to
or what
they
they
can
knew.
do now.
Yes.
Now, that was 2014 when you discovered there was a need, and I would believe that after that, budgets were put in place at county level for sanitation purposes. You as the ministry, is there a way of verifying that this budget is actually spent on sanitation?
Yes, I think we want to commend some counties who have actually taken sanitation as one of the major priorities within their places. And as I've said, one of the issues that we are going to interrogate is actually to see and check whether the counties are actually making progress in this. And if they are not, what are the challenges so that we address it. But as to how we at national level will be able to interrogate the counties whether they are putting a budget, it can only be out of their them actually informing us that yes, these areas when we are working, these areas we have been able to put in this budget. But essentially, all counties are under obligation to actually implement the sanitation issue access. All of them are actually under obligation to do that. And it is only when we actually get reports, like now, if part of the, as I've said, part of the engagement of this conference, which is taking place
from tomorrow to the 9th, 7th to 9th,
is actually to also see which are the counties. But we are aware that there are some counties now in this country which are doing wonderfully well in this.
Like where?
We have seen progress in Isiolo, we have seen progress in Nakuru, we are seeing progress in Kitui.
So when you say you're seeing what does this progress mean?
The progress is that we are seeing the management in those counties are taking issues of sanitation very seriously, and actually even putting some budget in and actually giving it a priority as one of the areas that they can actually use to enhance health within their counties.
Now, we were just, before we started this conversation, there was a very scary factor where they were talking about we waste over 57 billion shillings annually due to poor sanitation. What are we doing about recycling of water? You know, because like now that we have this drought, impeding drought, water is very rare, yet we're still wasting it. What are some of the things that we're doing as a ministry to be able to, one, recycle this water, bring it back to better use? What are the things that we've done?
As you are aware, currently at national level, our big business is actually to provide policy direction and guidelines. In the Constitution 2010, it required that RINE ministries or entities who are supposed to provide and give some policy direction or guidelines. Indeed, last year we were able to do all the prototype guidelines and the policies and even bills that which we launched by our minister, Dr. Mairu, and the counties. Of course, before...
So wait, these bills, you prepared prototypes and bills
yes, so
to be passed through county or national level?
No, you see, it's part of our capacity building. So the counties were supposed to, each counties would be, now the identities of each counties will be in variance, because this county will be having this problem. But generally, we must have a bill which is generally applied. Universal in the county, the country. So we prepared that one, and this was meant to assist the counties to have easy implementation. So these bills and guidelines, based on each county, they could actually use it. If they found it necessary to apply it as it is, they could actually just own it and change the name. But if they found that there are issues that they needed to address, specific with each county, they were given, there is room for them to.
So you created like a template. Has it been put to practice anyway?
Some have actually even passed it and adapted it within their counties. Some are actually discussing, some have not, and working with entities like UNICEF, World Bank, and the ministry. We are still agitating that each county should have its own rule, sanitation.
And on that note, now that you've mentioned UNICEF estimates that Kenya loses 57 billion shillings annually due to poor sanitation. What is the link between sanitation, good health, and this 57 billion we're losing? Could you help us understand that?
I think that study was commissioned by the Ministry of Health, and the study was done by both the UNICEF and World Bank by providing consultancy. Now, the connection about the big money is the cumulative wastage in terms of the time wasted by people in trying to address sickness in this area.
Oh, so time lost when you're sick.
Yes.
Okay.
The money spent in terms of hospital, drugs, and those things.
Okay.
It also accounts for wastage in terms of economical development.
You're not able to work.
You are not able to work. And there are also investments which are lost. For example, if there is an entity which would have wished to do like a factory somewhere, and then in the assessment you find that there are no enabling environment in terms of like safe water, sanitation,
there's a loss of business.
There's a loss of business.
Okay.
That is the quantified total amount.
That's how we get to the 57 billion.
That big money of 55 billion is also now, we have also been able to do it by county.
Wow.
Yes. And this has already been passed over to the counties. What each county is losing by not actually having sanitation as a
Now, who is doing badly for now? Okay, we've talked about Nakuru doing well, Isiolo doing well. Who are the ones lagging behind?
I think part of what we should be able to do in the national is to encourage the counties. I think it would be...
Why I'm asking is so that those who are in those counties can go and ask their county governments what is happening. What were Jibike? Who is not doing very well? I will not say bad. Who is not doing well?
I think the counties we are doing not well are the counties, I think all of us, even as a country, all of us, we are not doing well because we should be able to have 100% access. So why we are actually even discussing about sanitation, it means that we are not doing well. And we are not doing well as a country because the progression that we are having, I think it should have been, because we wanted to have 100% access by 2013.
Which is long gone.
That is long gone. We actually changed, and now we are looking at 2020. Now, that can only be reached if all counties are actually progressively increasing access. Now, we are aware that there are also some counties, in line with the question you're asking, which are actually as low as 5%.
Access to sanitation?
Yes.
5%?
5%. That is a disgrace for any county.
So what is the challenge there? Is it they do not have finances? Is it that people travel? What is the problem there?
I think that's what we want, partly why we are dialoguing for this conference, is what we want to understand. What is the big challenge? So that all of us, because in the conference, we are all going to be there as Kenyans. All counties are Kenyans.
Okay.
So we want to address what is the problem. How can we leverage? Because it is not the county now. There are some Kenyans in that county who are actually having a problem. So we are not now going to look at it as a county. We are going to look at those Kenyans who are suffering there. Why?
So if you're just joining us, in studio we have with us Dr. Kefa Ombacho, who is the Director of Public Health Department in the Ministry of Health. And we're discussing sanitation, which is, of course, the access to clean water and facilities to dispose of human waste. Now, there's a huge economic cost, of course, due to sanitation, which you have broken down quite well for us, and it affects children more. Could you help us understand? We're talking about some of the conditions and diseases that happen as a result of this. What are they?
Generally speaking, so that we don't go into the big science of the disease,
Not the simple ones.
I think generally, poor sanitation would be a cause of high instances of diarrhea.
Yes.
So, when we go into that, we can actually we can differentiate which, but it will be a cause of high incidences of diarrhea.
Mm-hmm.
And I think having any time you see any diarrhea or any case of diarrhea, I think the quick answer is that there must be poor sanitation and hygiene within that place.
In that area. And it can also lead to conditions, you said, like cholera and what else?
Now, cholera, those are some of the diarrhea or diseases. They could be dysentery, they could be cholera. But I think the serious thing that which shows outrightly that you are an individual is actually consuming his own shit is cholera.
Okay.
Actually, that tells you that you are actually eating either somebody's shit or your own shit. If you are actually having the bacteria.
Wow.
Yeah.
So we need to be. So that is why you were saying over 30 counties have are reporting constant incidences of diarrhea as one of the problems they're treating in the hospitals.
I think in this country, just before 2014, did you know that we didn't have any cholera? We had managed it.
We didn't.
We didn't.
So what changed between 2014 and now?
That's why we are being concerned, all of us, the nation and the county. What went wrong? And as we ask what went wrong, we also want to make sure that we actually put sanitation as a priority, because we know, as even when we ask ourselves what went wrong, we know the answer is that we must have sanitation as a priority so that we can stop that.
Now we have a drought situation right now. What are some of the things that we can do, even just my listeners who are listening to you, what are some of the things we can do to keep ourselves safe? Because water right now is a very scarce commodity.
I think that's a very good question you're asking, and I'm also happy that there are some places now it has started raining. As government, we are aware, and as a ministry, we are part of the bigger sanitation, the bigger drought mitigation campaign and implementation group. Now, drought situation is a quick thing that needs to be worrying anybody in terms of health. More so if there is reduced access to water. I'm now not even talking about safe water.
Yes, it is any form of water.
Now, starting from general cleanliness, hygiene, and even the water for drinking, that becomes a concern for us. It also goes to the extent of us also getting worried about issues of nutrition. But now the subject we are discussing is sanitation. Now, then it means that we must actually be very sensitive about monitoring the safety of whatever water that is available.
Right.
To make sure that that water is safe. And we must also ensure that even the water at the household level is not contaminated. Many times, even safe water reaches the house, and the water is actually contaminated within the household. So those are issues that needs to be addressed. Now, how? We have simple implements or facilities that would actually purify water at the household level.
Yes.
Or whatever water you are having, or whatever water you are having, meaning you could also be having water from a source which is questionable. So the very first thing is to make people understand that water must be made safe before it is used.
Yes.
And that is application of some tablets, which there are some small tablets.
Purifiers, yes.
To make the water safe. And of course, the bigger picture is the personal hygiene. The person's mentality in terms of how to handle and understanding that water can also be a source of a very serious risk of being sick. Yes.
Okay, fine. So so people need to be careful. Now, generally they say charity begins at home. So as much as we are saying sanitation is a county government thing, but also for us, what are some of the things we need to keep in mind when we are thinking about sanitation? Like, maybe is there a place where I should put my pit latrine or not? What are some of the things that we need to think about in our homesteads?
I think before even we go to the geographical locations about the counties, I think sanitation is the responsibility of individuals. And the individuals need to understand that they must take their health as their personal issue. So that actually then translates to the bigger populations, whether it is in the county or it is in the country. Now, the bigger things that people need to do is that I think the technologies are available. I am aware that people will be able to even indicate that the land size is small. So if the land size is small, then you have got to go waterborne. Now, waterborne doesn't necessarily mean that you have got to have technologies are available, depending on numbers of people and what you want to use.
So we don't have to have like a cistern, a flushing toilet.
No, if you are able, that is the best.
What if you cannot?
If you cannot, you have a pit latrine. And a pit latrine, if you can afford to have one which is made of marble or whatever, fine. If you can be able to have one which is made of
wood,
mud, wood, grass, fine. But it should be at all times kept clean and used. I think those are the basic. And again, we are also aware that in issues of contamination, I think the culture of washing hands is also a big issue and a deterrent from actually reducing the burden of disease in terms of reinfecting yourself. You are aware that this country, we did very well in issues of washing of hands, and I think we want to make sure that...
well, the children have learned. My concern is I don't think the adults really apply it.
I think that's part of I believe what you are saying, that goes to people. And although I think the entry point for us to be able to do the entry to the children, the expectation is that the children, normally when they go home, they will insist when the adults are actually doing the other side. But how we wish that the adults were the ones who are doing it, so that the children could copy.
Because the children do know, but I quite frankly, from observation, adults sometimes do not do it.
Yes, I think that's a part of what you were asking me earlier, culture. Yeah, so you believe that you should be able to continue doing things the way you used to do them the other day. Yeah, so things must change.
So things definitely need to change. Now, as we wind up, this is a question we like to ask all our guests. So I want to ask you, as Dr. Ombacho, what motivates you to get out of bed every morning? And life has challenges. How do you deal with them?
I think one thing is that this is a subject I'm very passionate about, and I've been able to do it. I've been given a chance by this country to be able to do this. So really, I've got no business not to be able to do it. And I think what motivates me is when I see us as Kenyans improving and scaling up in terms of gaining some indicators which are positive. I think that's very good for the country. It's good for the ministry. It's good for everybody. I think that should be the motivation of every individual, and I think it should be even a motivation at the household level. An individual who will be able to have a family that has remarkable reduced number of people who are actually having instances of diseases that can be preventable. I think that should be a very serious motivation, because what does it translate to? It translates to a lot of savings.
Yes.
Yeah.
Now, you as a person, now wachana na daktari kila kitu, you as this gentleman I am seeing here, life has challenges. How do you deal with them?
I think it is always to be positive and make sure that you are focused on what you do. Indeed, as we work or as we do whatever we do, there are challenges. I think those should not be. You should not allow any negative issue to divert your thinking. You should be. You should actually have your principles and believe in them. And the bottom line, I think what has also made my work easy is actually to have linkages with the stakeholder concerns in this area. And I think that has been very positive, has been very well for us as a ministry, because it has even brought in resources that we didn't have.
So there you go. That is a man who has serious passion for sanitation. He's broken it down mpaka house level. And his name is Dr. Kefa Ombacho, who is the Director, Public Health Department at the Ministry of Health. We want to thank you very much. And we hope you can give us findings when you come back from this conference that starts tomorrow to the 9th at the Safari Park Hotel, where they'll be reviewing with the counties what has been done for sanitation. You need to let us know who are not doing well, that 5%, so that we can go back and ask our people what is happening.
For sure, even without going to this conference, which of course I promise I will give you, I will ensure that I give you the breakdown because it is for public consumption.
Yes.
For each and every county and what it costs and where they are. The conference will be opened by our minister, Dr. Kefa Ombacho, the minister for the cabinet secretary for health, and all of us are welcome. And I want to urge Kenyans that we can make our lives easier. I think there are simple things that we can do which have got a lot of savings in our life. Can we have sanitation as a priority? Can we have access to safe water and some kind of a latrine where you actually do that and wash your hands? We will be all well.
Kwanza, the washing hands. Please, 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 please. The children are doing it. Can we also wash our hands?